So this is a memory trick to remember the acronym MONA, and this is in the event of a patient having a cardiac arrest. So the best way to remember this is what medications we give in what order is M for morphine, O for oxygen, N for nitroglycerin, and A for aspirin. And this is the order of what we do, what we give in the event of a heart attack. So picture Mona Lisa receiving some morphine. So this is the first thing that we do. So we need to initiate some pain relief, which would be morphine. So just think of Mona Lisa and the famous smile when she's had a dose of a morphine injection. So generally, when we give morphine, the optimal dose is roughly around 2 to 4 milligrams given IV. We need to monitor closely for any adverse effects, i.e., because morphine obviously can, it's a respiratory oppressor, so it can kind of slow the breathing down. But we also need to inform the doctor to tailor the doses. So that's generally what we do for that. So visualize the picture of Mona Lisa breathing deeply. Visualize her surrounded by a cloud of oxygen and symbolizing the importance of oxygen therapy in the event of an MI. Protocol for oxygen administration post-MI involves providing 2 to 4 liters per minute to maintain oxygen saturations between roughly 94-98. Adjustments can be made on the patient's condition. Imagine Mona Lisa holding a tiny nitroglycerin spray bottle or a tablet container in her hand with rays of light emanating from it. Imagine her heart opening up like a flower as she takes in the nitroglycerin, symbolizing its vasodilatory effect on the coronary arteries. Associate the letter N with nitroglycerin and the concept of coronary vasodilation nitroglycerin as it is administered to patients who have had a heart attack, and this will help improve the blood flow to the heart and muscle. Typically, we start off with 0.4 milligrams of nitroglycerin sublingually, usually under the tongue after an MI. We usually repeat every 5 minutes or so, and the only thing we can give is up to 3 doses until the symptoms subside. So visualize Mona Lisa holding a small bottle of aspirin or holding a plate with aspirin pills arranged in the shape of a heart. Visualize her taking the aspirin with a glass of water, and this is a symbol that helps prevent blood clot formation. Aspirin and the concept of antiplatelet therapy. Aspirin is commonly given to patients with an MI. This also helps reduce the risk of any further cardiac event. So in the acute phase of a myocardial infarction, the standard dose of aspirin is between 162 to 325 milligrams after the onset of symptoms. This helps reduce the sequential cardiac event. Always follow the specific recommendations by a healthcare provider based on the patient's medical condition and medical history.